Hi, in this video, I'm going to be talking about how long side effects of chemotherapy last. We're doing this video because we got a comment and question in one of our previous videos. Make sure to subscribe. We put 3 videos out a week, so we're always having new content that you can watch. So chemotherapy is medication that we give either by vein or by mouth, depending on what the purpose of therapy is and what treatment options are available. Chemotherapy affects rapidly dividing cells, and it affects cancer cells more than normal cells because in general, cancer cells are dividing more rapidly, which makes them more vulnerable to chemotherapy. But the short-term side effects of chemotherapy are usually due to the fact that there are other cells in our body that are dividing rapidly and that are sensitive to chemotherapy, as well as some other factors that can contribute to side effects. So in general, the short-term side effects of chemotherapy, which I'll list in just a moment, tend to occur and be worse at the beginning of the cycle, and then they improve a little bit before the next cycle, and then you feel them again. So the side effects I'm talking about specifically are nausea, which will be most severe in the couple days after chemotherapy, sometimes vomiting. I actually sometimes hear that nausea is worse than vomiting, that stomach awareness can be more unpleasant than just throwing up and sort of starting the day fresh. But these side effects are a direct result of the chemotherapy in the body. And after the body's cleared the drugs, even though they've been taken up in the cancer cells and other cells, the side effects tend to wane. Some people, the chemotherapy side effects of nausea will persist longer, and it's really important to let your medical team know. And actually make sure when you go back for your next visit that you tell your medical team just how bad it was. And you may have forgotten, so bring somebody with you or write it down so that people really understand how severe your side effects are. We won't think worse of you. We need to know so we can take better care of you. Other things that occur are fatigue. Now, fatigue can be really quite severe the first day or so after chemotherapy, and that may be because we're giving you medication to prevent nausea and vomiting, which can be quite dreadful, and they can be quite sedating. So the fatigue, you may notice a decrease in your energy the first day or so after chemo, but I do want to prepare you if you're just starting out that fatigue actually gets worse with each cycle. Your body's just had more and more given to it. So by the very end, that's usually when the fatigue is worst. Now, over time, the fatigue can get better. It will happen so gradually that sometimes you won't even know that the fatigue is getting better till you think back to how you were 3 months before. Most people notice that their energy level returns to normal by 6 to 12 months. Again, it's not like you feel exhausted and then one day finally you feel better. It's just gradual improvement in your energy level. About 5% of people, 1 in 20 people, will have long-term fatigue. And we're not exactly sure who this is going to be. We have some hints on who may get long-term fatigue, but it's quite uncommon, although not uncommon enough. Other things that you'll hear about and know about when you're going through chemotherapy are that your white blood cell counts will go low between each cycle. So you'll get your first day of treatment, then there's the next treatment, that time between, that whole thing's called a cycle, or you might hear it called a round of chemotherapy. And because the bone marrow, where white cells are made, is rapidly dividing and white cells are made very quickly, those cells are affected by chemotherapy. Your white cells will recover, usually in time for your next cycle, your next treatment. If they don't, your chemotherapy will be delayed, often a week or a couple days in between. And you should be confident that your body's actually feeling a pretty good dose of chemotherapy. So despite that delay, the way your body metabolizes the drugs means that those cancer cells are seeing the chemotherapy a little bit longer. If you're on growth factors to keep your white cells up, your white cells may not come down to the same extent, or if they come down, they won't stay down for quite as long. Your bone marrow will recover at the completion of chemotherapy. I have seen a couple people in my career where their white cell counts were persistently very, very low afterwards. Surprisingly, although we tell you not to be exposed to things so you don't get an infection, most people with a low white blood cell count don't get infections. So your body's quite resilient, and we have some redundancy in the number of white cells. So although your white cells may not rebound to exactly where they were before treatment, you are most likely not at excess risk of getting infection. Other side effects like mouth sores, diarrhea, constipation, they tend to improve by the time you get your next treatment. And if you're all done with treatment and you're still having those side effects, it may be something else, other medications that you're on, or another medical condition that it would be worthwhile talking with your primary doctor or other members of your medical team about. There are two other short-term side effects that I'd like to address here. One is appetite and taste. Chemotherapy can affect our taste. It's most pronounced right around the time of chemotherapy, but you may notice through the entire course, all the cycles of your chemotherapy, your taste is altered and that your appetite is different. Foods that were your favorite foods, you may not have any interest in, and things you never liked before, you're having cravings for. We do have other videos that we'll link to about taste and how to manage your mouth health during chemotherapy. But one thing I did want to share is that a lot of times people note that water tastes metallic, that meat tastes metallic. The flavor that people seem to like the most is citrus as opposed to mint. So you may find that putting lemon on your vegetables or on your fish or whatever it is that you're eating can be helpful in improving the taste of food. If you're a vegetarian, lemon risotto, that kind of thing, try those sorts of things to help. If your taste seems to take longer than other people's to recover, don't worry, it will come back, and your favorite foods will very likely be your favorite foods again. And then the last one is hair loss. Hair begins to fall out in people getting chemotherapy. That causes hair loss about 17 to 14 days after the first treatment. And once it starts to fall out, it can fall out very quickly after that. Usually people note that 3 months after the completion of chemotherapy, after their very last chemotherapy, their hair has grown in enough that they're comfortable taking off their scarf, or if you've been wearing a wig, taking off their wig. And some people even like to get their hair cut because their hair might be growing in all different directions as it comes back. Usually people will note that their hair is, full and thick by about 6 months. And although the texture may be different, and that may or may not go back to the way it was before treatment. So if you had straight hair, it may come back curly. That's the most common change we see. And you may live with curly hair the rest of your life, or it may straighten out over time, especially as it grows in. It'll be very soft when it comes in, which a lot of people like the way that feels. It's so awful to lose your hair. When it comes back, it's really exciting. So those are the short-term side effects and how long we generally see that those last. I haven't covered all the side effects of chemotherapy. You can check out our video on short-term side effects of chemotherapy for more information. So next I'm going to talk about the long-term side effects of chemotherapy and what we tend to see in terms of recovery. I'm going to start with chemotherapy-induced menopause for people who have functioning ovaries, who were menstruating, or if they had, for example, a form of contraception that decreased their menstruation, but the ovaries are still working. Chemotherapy can put people into temporary or permanent menopause. It usually takes about a year from the last chemotherapy before we say somebody is unlikely to have their periods come back or their cycles resume, whether or not you're menstruating. So it takes about a year for us to be sure. And if you're on tamoxifen, you may not have periods like you did before. It can suppress menstruation without putting you into menopause. So sometimes we have to do blood draws to look at your hormone levels to see if chemotherapy has put you into menopause permanently. So give it about a year, and I've had people where their periods come back even 14 or 15 months later. And then if you're on tamoxifen and you stop the tamoxifen, your periods are likely to come back after that. We do have a video on treatment-induced menopause you may want to check out if this applies to you. The other side effects, one of the other side effects that's long-term is emotional adjustment. So you've been slammed into treatment. You had a life before cancer and a life after, and you're wondering, when am I going to start to feel like myself again? One of the things that I want to encourage you to know is that as your body starts to feel more like your own body, even though it might look different or feel a little different, your emotions will also start to regulate. If you find that you're living with severe concerns about recurrence or mood swings or feeling really down, talk with your medical team. We do have a tendency to undertreat and under-recognize mood changes, whether they're the result of cancer or not. So if your emotional well-being is not coming back within 6 to 12 months afterwards, seek out help, whether that's professional help or a support group with a facilitator. Talk with your medical team to make sure that everybody knows how you're feeling. Another side effect is peripheral neuropathy. Peripheral means on the periphery or the edge. We refer to the nerves in the fingers and the feet as peripheral nerves. Those nerves are sensitive to chemotherapy. We tend to see it start in the fingertips or in the toes and then move upward, up the hands or up the feet. Peripheral neuropathy usually gets better after chemotherapy, although there may still be some residual side effects. Some residual neuropathy, even many, many months or even years after chemotherapy has been given. You didn't do anything wrong. Even if you didn't tell your doctor that you were struggling with it during treatment and you wish you had, you didn't do anything wrong. The chemotherapy is a toxin to cancer, and some chemotherapy drugs are also toxic to the nerve endings. I never give up hope for neuropathy to get better, I'll be honest. The nerves are amazing. They regenerate very, very slowly, about 1 millimeter a month. So if you have 5 centimeters of numbness, that's going to be a lot of months before there's recovery. But again, I never give up hope. I have a patient who's over 10 years out now, and she's finally feeling like it's gone after many years of thinking that she would be living with this without any improvement. So try not to give up hope with peripheral neuropathy. Make sure you talk with your medical team. There are things that we can do to help that don't require being on more medicine. And then, of course, medications can help with the symptoms, especially with painful numbness or just straight out pain. Another long-term side effect I'd like to address is cognitive problems related to chemotherapy. Now, quite a few studies have been done showing that people, even before they start chemotherapy, after they've been diagnosed with breast cancer, already have some cognitive impairment. And by that I mean memory, remembering word, look at me, here I can't even remember a word. So with word finding problems. So if you have chemotherapy and you notice that you're having problems finding words, you might wonder, do I have chemo brain? Well, there are lots of reasons besides chemo brain that can cause that, like anxiety, depression, sleep disturbance, hormonal changes. Even if you're young and your periods are likely to come back, just those fluctuations can make things really hard for you. You may be struggling with some pain after your surgery or other side effects that can make it harder for you to concentrate and harder for you to remember things after chemotherapy. So chemotherapy itself very likely has an impact on cognition long-term in some people. It's not clear who's going to have that from chemotherapy, but it is one reason that we try not to give chemotherapy if we really don't think it can help. Because cognitive problems and fatigue long-term after treatment that had very little benefit is really discouraging. It's discouraging even when there was tremendous benefit. But these are the side effects that we weigh really carefully when we're thinking about whether chemotherapy should be part of somebody's treatment plan. Cognitive problems can get better. There are some things that you can do to feel more sort of, I was going to use the word nimble, but nimble of mind. Things like word games can help, although they may not prevent long-term dementia. They can certainly help you feel more on top of your game. It may be during word games, however, that you first notice the problems. So people with a very high level of cognitive function, people who do the crossword puzzle in ink, tend to be the ones who notice problems with word finding and memory and concentration more than people who don't tend to enjoy these sorts of things. So you may notice that these things are harder for you to do than they were before. I don't want you to give up hope. There's also some real evidence that learning another language can improve your cognitive abilities, can help with word finding. So if you used to study a language and you'd like to revisit it, or if there's a language you'd like to learn, there are all sorts of apps, and of course there are classes, and you can talk with other people, now by all over the world and learn another language. That has been shown to help with cognition. So it's just something I want to put out there as something that might be able to help you. Another long-term, it's a problem much less than a side effect, is bone loss. Going through chemotherapy, whether one goes into chemotherapy-induced menopause or not, can affect your bones. There really are no symptoms affiliated with bone loss unless you have a fracture. So bone loss is asymptomatic, no symptoms until we have a fracture. We've had some really good questions about if is the fact that I'm able to do all these things means my bones are strong, and we actually don't know. Bone health, if somebody isn't given anti-estrogen therapy, will improve away from chemotherapy, particularly if you do weight-bearing exercises. We have a whole other video on bone health after breast cancer. If you're going to go on hormonal therapy and you're postmenopausal, tamoxifen can be very good for your bones. Aromatase inhibitors decrease the strength of your bones. But again, loss of bone mineral density doesn't have any symptoms associated with it. So you might be curious about what will determine how long side effects last. Why am I giving a range of how long things tend to take? Well, there are lots of things that can affect how long symptoms will last. One is just individual differences. So we can't tell in a given person how long their body will take to recover. There's some association between age and recovery. So it's sort of paradoxical. Older people who have more medical problems, who may not have had as high a functional status beforehand, may notice it takes them longer because they weren't quite as fit. But the same thing could be said for younger people who aren't as fit beforehand. It may take you longer to recover. In general, though, younger people tend to, I'm going to use air quotes around this, bounce back after treatment. The one thing that I'd like to point out, though, is if you're much younger and you don't look like the people in the waiting room or in your doctor's office who look much older than you, there can be a real sense of isolation. So some of the side effects, like the emotional side effects, the mood side effects, your energy, may take longer if you're living with social isolation or loneliness. Check out our video on loneliness for some tips about managing loneliness. People who are older going through breast cancer may have many other people in their life who've been through it. So they have a community of people that can help them help normalize their symptoms. This is all part of it. It'll get better, and tell them for them when it got better. So age is kind of interesting. It relates a lot to your support community, whether or not you're experiencing loneliness, and also your level of fitness even before you were diagnosed with breast cancer. And then the most important thing is the actual regimen you get. So the actual drugs that are given as part of your chemotherapy have a big impact on when the side effects either occur at all or how long they take to recover. In general, the more chemotherapy, the longer it takes to recover. Targeted therapy, I just want to do a little aside, is a little different because the side effects of targeted therapy without chemotherapy tend to be much better than with chemotherapy and targeted therapy alone. So once your chemotherapy is done, even if you're on targeted therapy like trastuzumab, HER2-directed therapy, your chemotherapy side effects will get better. And fatigue will get better for the most part. There are some people who note persistent fatigue until they're done with the targeted therapy, but most people generally feel better once chemotherapy is over and then, in the ensuing months. I've covered a lot in this video. I hope it's been helpful. Don't forget to subscribe. You can also go to yerbba.com to get your personalized report. Drop a comment below. Let us know how long it took your side effects to go away. Share your experiences with the Yerbba community. And if you have questions, I can answer them in general terms, although, as you know, we can't give medical advice. Thanks so much for watching.